I am Dr. Ajit Kumar, Neurologist and Medical Director at the NMC Specialty Hospital in Al Nada, Dubai, United Arab Emirates. Parkinson's is a neurodegenerative disorder where there is loss of cells that produce a chemical called dopamine. These cells are located in a thumbnail-shaped area in the brain called the substantia nigra. The substantia nigra, or the black area of the brain, which is actually in the midbrain, or the portion of the brain that connects the brain to the brainstem and the spinal cord. And there's loss of neurons or cells in this particular area of the brain, and these cells which produce dopamine die out, and it's very unclear at this point what exactly results in the death of these cells. There are actually three cardinal symptoms of Parkinson's disease. One is tremor or shaking, which is quite common. The second one is rigidity or stiffness of the limbs. The third one is bradykinesia or slowness of movement. These are the three cardinal signs of Parkinson's, and there's a fourth one which is often comes late in the disease, which is postural instability or loss of balance. So if somebody has one cardinal sign, then we say possible Parkinson's. Somebody has two cardinal signs, with or without postural instability, we say probable Parkinson's, and if someone has all of it, we say almost certainly definite Parkinson's. Parkinson's, by and large, is a disease seen after the age of 65. But having said that, Parkinson's can happen in much younger individuals when it's called young onset Parkinson's, people who are as young as in their 20s and very rarely even in their teens. But this is the exception rather than the rule. More than 90% of the cases of Parkinson's disease, the garden variety of Parkinson's disease, do not have a genetic basis. But about 5 to 10% of Parkinson's disease, there is a genetic basis, and there's a growing list of genetic mutations that can produce Parkinson's disease-like symptoms. Unfortunately, as of today, there is no permanent cure for Parkinson's disease. But having said that, the symptomatic treatment of Parkinson's disease has grown by leaps and bounds, and people with Parkinson's disease today can lead a much better quality of life. They can have a much better quality of life as compared to people with Parkinson's, say 20 years ago, because we have excellent medications and in some cases even surgical options to improve the symptoms of Parkinson's disease. Well, my recommendations are, if you have symptoms that you think may be Parkinson's, see a neurologist as early as possible so that treatment can be started early. Because there are some studies showing that the sooner you start treatment, the better it is. And it's important to maintain a healthy body weight and an active lifestyle. There are studies that show that people who maintain an active lifestyle seem to have a much slower progression of Parkinson's disease as opposed to people who don't.